ECDC On Air,
the podcast of the European Centre for Disease Prevention and Control.
Keeping up to date with European epidemiology.
Hello, welcome, and thanks for tuning in to ECDC On Air, the podcast of the European Centre for Disease Prevention and Control. I'm your host, Lee, recording from our headquarters in Stockholm, Sweden. On today's episode, we're speaking with Leonidas Alexakis, expert in epidemic intelligence here at ECDC. And today we're talking about his recent deployment to the Democratic Republic of Congo and working on the Mpox outbreak that's ongoing there. So today we're sitting down with Leonidas Alexakis, expert in epidemic intelligence here at ECDC. Leonidas, thank you for joining us.
Thank you so much, Lee.
So before we begin talking about the work that you were doing in the DRC, could you tell us a little bit about your work here at ECDC and about yourself?
My name is Leonidas Alexakis. I work here as an expert in epidemic intelligence, which is part of the surveillance section. So my career started, I used to be a medical doctor in working with Doctors Without Borders. And then I started my work here. So our work in epidemic intelligence constitute in early warning and threat assessment. So the idea is that we try to identify potential threats to the EU population and provide an assessment and then communicate this to our stakeholders, which are mainly the member states, in order to take the appropriate actions.
Okay, so you recently were in the Democratic Republic of Congo, the DRC, as part of the European Health Task Force. Could you give us a brief overview of your mission there and the role that you played?
Sure, yes. I had the privilege to be called on to go to the DRC as part of the Health Task Force. So this task force is a new task force, so I was thrilled to have the opportunity to be part of it. So I was deployed there through the task force, but I was embedded within WHO structures. So this is through the GORN network. And this was facilitated through the DG INTPA financing through the project, the joint project we have with Africa CDC. So that was a multi-partner, let's say, deployment.
So before you carry on, what is GORN?
So GORN is a network. It's the Global Outbreak and Alert Network that is managed by WHO. And there are a lot of partners that are utilized when there are outbreaks for supporting countries that need that.
So what specifically were you doing on the ground in the DRC?
So I went to the DRC due to the outbreak of Mpox. So there's been an ongoing increasing trend of Mpox cases in the DRC. And back then it was not declared as a public health emergency of international concern yet, but there were worrying alerts coming from the DRC. So the WHO GORN network, so the Global Outbreak and Alert Network, posted a request for assistance, which the task force replied through. And that was financed through the DG INTPA financing through the project we have jointly with Africa CDC. So it was a bit of a mixed partnership there. And what was my job there was quite different day to day, and I had let's say a dual role. So firstly was to support the WHO country office as well as the Ministry of Health and the Institute of Public Health of the DRC, so the national authorities, in improving their response, meaning from surveillance, but also different pillars. So that was one part, and then the other part, as member of the task force, was to identify areas that ECDC could further support. Because what is quite novel with this deployment is that it's quite long term. There's still 2 colleagues there, and there will be colleagues until the end of the year. So it was crucial for the task force to find what which pillar and where we would make the most significant impact.
Okay, so what specific surveillance tools did you support? And so how did that change or improve data collection?
So the data collection at the national level happens through different tools. There are the more routine standard surveillance tools, the IDHR, which is not specific to Mpox, but the notifications of Mpox cases and deaths are being recorded, and that happened even before the outbreak. But because there were many unknowns, we still know little about this new clade that we see emerging currently in the DRC. There were many unknowns, and in order to be able to assess and understand what is going on, and to have a better understanding of the characteristics of the virus, but also the transmission patterns in the country, there needed to be additional information collected. And this is where we came in with WHO, but also with other partners on the ground to enhance and to find new variables that are needed in order to assess the severity, the transmissibility, and other major questions that we still have around the new clade.
Before we get on to sort of talking more about analyzing the data itself, could you walk us through what a typical field investigation looks like? What are the sort of challenges that you encounter?
Well, the DRC is a very big country, and everything becomes more difficult, especially logistically, from the connection to the internet, which is unstable, but also there are some areas that are very hard to reach. So things that would happen here, for example, with just an email, there they might require very cumbersome logistics. You might need an airplane. Like I had to, in order to access the second area where I visited in Ecuador, I had to go via airplane. They're not very often flights. So it's quite cumbersome. Everything becomes a bit more difficult. But I would say mainly the connectivity and the logistics really complicate everything.
Okay, so when it comes to analyzing this data, obviously now you've mentioned the challenges that you have. When you are looking for sort of trends in the different findings, does it take then much longer time to find these?
Well, everything has to do with the quality of the data and the timeliness of the data. So the whole question is, do you have enough information in order to have meaningful results? So the analysis per se might not take more time because it's the same as everywhere else. Maybe the tools and the expertise are different, but that's not usually the issue. The main issue is to be able to have data that really allow you to answer the questions that you have. Yeah.
Aside from, things like data collection, what are the challenges in the DRC that are contributing to the Mpox?
Yes, I think this is important to highlight. Currently, the DRC has many concurrent outbreaks, and they're trying to respond to different health issues, which I think is something that really strains the capacity of the human resources. It's impossible to have everyone in all of these regions at the same time. But as an example, what I can tell you is while I was deployed there was a suspicion of an Ebola outbreak in the north. Half of the Ministry of Health and of WHO needed to redirect immediately their attention to the suspected outbreak, which fortunately turned out to not be Ebola. But just to say that everything is difficult when there are concurrent outbreaks and emergencies.
On a more personal level, what are the more challenging or the most challenging aspects of working in such an environment? And how do you manage to stay motivated?
One of the main challenges with my mission, due to the exploratory factor, I had to travel a lot internally, meaning I had a very short time to meet the appropriate stakeholders, explain who we are, what we're doing, and what we can offer. So having a short time to do all this was the main challenge. Now on the motivation side, I felt quite thrilled, to be honest, to be part of this first deployment to the DRC. as I always like being deployed with a task force, but this was quite special as it's one of the longest deployments that we have with 2 people at the same time deployed. So it was very interesting to be part of the task force and to really be on the field responding to an outbreak.
What lessons or experiences from this deployment do you think will be valuable for future public health responses?
I think there are lessons learned at different level. So there's firstly the lesson learned from the task force and the ECDC here, which I think what was very interesting and what we managed to do really well now was the flexibility. We managed to be able to very quickly find someone to support remotely when there was a need for remote support for data analytics or for more in-depth work. We were also able to work with different partners there and be flexible depending on the needs and on the timings and the availability and the want to engage with us to change who we work with and who we deploy with. So I think these are the lessons that the task force has learned through this deployment and will be very useful for the next deployments. Maybe something just to add there would be that the early deployment, I think, was something that was very helpful. Being able to be there before it becomes a public health emergency of international concern really allows to establish a presence there and to be as effective as possible.
Well, that's all the questions we have for you today, Leonidas. Thank you very much for joining us.
Thank you, Lee.
We hope you enjoyed this episode on the European Health Task Force. If you would like to know more about the task force itself or about the Mpox outbreak, please visit ecdc.europa.eu. Or you can follow us on social media for the latest news.